Into that, and starting today through Tuesday, they're going to be at the American Society of Clinical Oncology's annual meeting. Here with the latest developments from the emerging from the meeting is Dr. Louis J. DeGennaro. He's with the Leukemia and Lymphoma Society. Also with us is Dr. Gail J. Robos. She's a professor of medicine at Weill Cornell Medicine and at New York Presbyterian Hospital. It's great having both of you. How are you?
Doing well, thank you.
Good morning.
All right, so we'll explain what's happening at this annual meeting. What is it and what's happening there?
It's really an exciting weekend for cancer research and for the development of new therapies to treat cancer. As you mentioned, the American Society of Clinical Oncology meeting is happening as we speak. This is an opportunity for literally thousands of cancer researchers and physicians who treat cancer patients to come together, reveal data from the latest clinical trials and study that data. And in studying that data, understand better what new treatments might be available to add to the armamentarium of treatments for cancer patients going forward, new treatments that hopefully will lead to better outcomes and maybe someday even cures.
Absolutely. Is there any big news expected at this year's meeting?
I think we're going to hear lots of big news cutting across all different cancer types. Again, the Leukemia and Lymphoma Society is most excited about those agents that will impact blood cancer patients, leukemia, lymphoma patients, patients with multiple myeloma. We're going to hear advances in a technology called immunotherapy, using the patient's own immune system to find and attack the cancer. And we're going to hear advances in our ability to repackage existing drugs that we have in hand already that we know work to some extent, but repackage them in a way that they can be delivered better, in a way that they are more effective, and frankly in a way that makes them safer to use with patients, again leading to better outcomes.
And that's obviously the goal. Now, blood cancer therapies, they can actually help patients beyond blood cancers, correct?
Well, they can. The immunotherapy is a really great example. One form of immunotherapy called CAR T therapy was pioneered in the blood cancers. It was pioneered in leukemia. But now it's being tested, and we'll see some of this at the meeting, it's being tested in patients with very many other forms of cancer, breast cancer, colon cancer, prostate cancer, even pancreatic cancer. So this is a prime example of how blood cancer research leads the way. It's the tip of the spear in cancer research, and then pays benefits to patients with other forms of cancer.
Absolutely, and I know LLS has really played a huge role in helping the advancements in cancer research. Explain the hard work that's being done by them.
Well, we have. In the last 20 years, we've deployed $1 billion.
Wow.
Due to the support of all of our donors across the country. We've been able to deploy $1 billion into cancer research at academic centers like the one Dr. Robos represents, and in biotechnology and pharmaceutical companies as well, to accelerate the rate that these new therapies are coming forward.
Excellent. Dr. Robos, let's talk to you. You're an expert in treating patients with acute myeloid leukemia, one of the most lethal of all the blood cancers. What advancements have you been seeing on the horizon now after more than 40 years without really a change in the treatment of these patients?
Well, we're hoping that 40 or 50 years later, we actually can make the same two drugs work better. So there are data being presented at the meeting that suggests that a novel way of formulating our two old standard chemotherapy drugs is now better. And also we're looking at immunotherapeutic and targeted therapeutic approaches to help patients with AML and to finally push those curves out of the last century.
That's excellent, and I know it's been your life's work as well as your fellow doctor there to try to find some clarity and hopefully be able to treat these patients and give them further their lives. So it's great work that you're doing, and it's great having you. Thank you so much for joining us.
Thank you very much.
It's a pleasure. If you want to find out more about advancements in blood cancer cures and more, lls.org, that's where you got to go. Megan, over to you.
Thank you, Sean.